Welcome to the She Found Motherhood podcast. Today we're talking to Noelle, a registered dietitian from Nourished Beginnings. We talk about how we can prepare with our nutrition for getting pregnant, talking about how to choose the right prenatal supplement, how to optimize our iron intake, and also the importance of folate and folic acid when thinking about getting pregnant. If you are thinking about getting pregnant or newly pregnant, check out our Preparing for Pregnancy download. It's a free guide on the 10 things that you should really think about before you get pregnant, or if you're just freshly pregnant. We will get to the podcast right after this. Welcome to the She Found Motherhood podcast, where our goal is to support you in the journey from pregnancy through to parenthood. We are so passionate about this time in a woman's life, and we want to make sure you have fun and reliable information you can trust. She Found Motherhood podcast is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This does not apply to every situation. If you have questions or if you have received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Hey, Noelle, how are you?
Hello, so good to chat with you today. Thanks for having me.
You are welcome. Thanks for coming. Today on the She Found Motherhood podcast, we are chatting with Noelle from Nourished Beginnings. And we were hoping to focus today on preparing for pregnancy and the nutritional needs around that, which I think is a topic. Well, you're passionate about all things pregnancy, postpartum. I know that, but kind of the preparing, I think a lot of people struggle with that kind of how can I optimize my nutrition when I'm thinking about trying or starting to try to get pregnancy. So thank you for chatting with us about that.
My pleasure to be here. And I think one of the reasons why it can be difficult is, 50% of pregnancies are like somewhat unplanned, right? On one end. And then there's the other end of people who may be struggling with infertility. And it can become very difficult to be like, how long am I preparing? When in reality, then it just kind of adds to that longing. It adds to that reminder. And so as we go through today, I think it's really important to remember that what we're talking about is overall wonderful nutrition and we're going to talk about some timing pieces that are ideal, but I don't want anyone to go through a place of guilt if they find out they're pregnant and they didn't do these things. Please know it's okay. And on the other end, if you're struggling with infertility and, for lack of a better word, obsessing over these things is adding to your emotional grief, it's also okay to just back off a little bit. So we're going to talk with nutrition. It's such a spectrum, right? And it's important for us to talk about these things that matter so that we are educated and we understand. It's also important to take that moderation outlook. And, it's a great introduction to motherhood where you do the best you can with what you're given and you go from there.
It's true. I gave my husband every year for Father's Day, I make him a mug with pictures of the kids from that year. And the first one I gave him, world's most adequate dad. Right?
Amazing. I love it.
You just do the best you can. I come home at the end of the day. He's like, they're alive. I succeeded. I'm like, great. Right. But it's so true. And those little babies, they'll suck everything they need out of you. So, yeah, exactly. Just you do the best you can. And that's all you can do. So, and you and I are going to do another podcast around kind of the challenges with first trimester nutrition as well. So we'll do that one later, but that's something for everyone to look forward to.
Yay.
All right. So what are your top kind of tips for us?
Okay. So a couple of things come to mind. One is thinking about gut health. So quite often we right away, like if someone's listening, they're probably thinking, oh, she's going to start talking about iron and, folate and folic acid and stuff like that. And we're going to get there. But it's really, really important for us to think about the fact that the gut health of our baby comes from us. And we know that gut health plays a role in many aspects of our overall health, including our mental health and our immunity. And so for a mom heading into pregnancy, it's very important in terms of all of that for her. And then preparing this wonderful, environment and microflora for then to pass on to the baby. So our microflora starts to develop when we're in utero, so when we're growing inside of mom. And then it's also affected by the birthing process. So if we have a baby that is born vaginally, then the gut flora is a little more like mom's actual gut flora. And then if we have a baby born via C-section, the gut flora is a little bit closer to that of like what we would see on the skin. And so those babies, they may benefit or will benefit from more probiotics, something like a BioGaia or something like that, just to kind of boost the gut flora. So leading into pregnancy, having a wide variety of fermented foods, things like Greek yogurt and kefir, sauerkraut, having those as part of just kind of your regular foods that you eat. And then also something called prebiotics. So prebiotics are kind of like the food for the healthy gut bacteria. And prebiotics are found in anything with soluble fiber. So things like oats and barley and the inside of a lot of vegetables and fruit. And then they're also found in like a less ripened banana. There's something in there called FOS or fructooligosaccharides. And there's different prebiotics and there's different probiotics. And the more variety that we have, the better basically gut flora that we have and the better we can pass over to baby. So the next question then is, well, you've listed all these foods. What about a supplement? By all means, a probiotic supplement and even a prebiotic supplement can be part of your health regime. We do know that anytime we turn to food, whether it be for a probiotic or whether it be for some of the vitamins and minerals we're going to speak about, anytime that we turn to food, we're seeing that we get a wide variety in nutrition, right? So if you think like, oh, an iron supplement, yes, there's a concentrated amount of iron there. But if you were to look to something like chicken or fish, you're also getting protein, or in the fish, you're also getting omega-3. And I love to think about nutrient density as much as possible. So when we turn to food, we typically do see that better outcome. But supplements do play a role, and there's several beautiful supplements on the market that are even targeted towards like women's health and the type of gut flora we'd want. So that would be one of my first recommendations, is really dig into how does your gut flora work right now or look right now? And is there anything that you could improve dietary wise or supplement wise to try to just take that to the next level?
Can I ask a question?
Yeah, please do.
In terms of kind of refined sugars, how does that affect your gut flora? So there's, like we have our kind of whole foods, our plant-based whole foods, which obviously we all know has tons of great evidence for them. But we have our more refined sugars, or refined foods. How does that affect your gut flora?
So simple added sugar needs to be looked at in terms of a total amount, obviously, and then also where it's coming from. And then how it affects us. And to be quite honest, it can affect people slightly differently, right? And this is where we don't have like really good peer-reviewed research. We have more anecdotal research to say we notice a difference in some people and not others. And so we can't say a hard and fast rule. But what we do know is that some people do seem to react with more inflammation in the body. They seem to, have a bit of a sacrifice in terms of their gut flora, like more yeast infections, more common to come in some people than others for the same amount of sugar. And so if I have someone who is saying, I'm seeing these things, do you think it's connected? It could be. If you're seeing that correlation, it could be. So let me help you reduce that. I also don't think that we need to live in a society where we're cutting out all refined sugars, because that can become very restrictive and isn't great for mental health either. I try to encourage individuals as much as possible to think about how nutrient dense, how much nutrition is in the food that has sugar. So for example, if we have someone who says, well, I don't really like plain Greek yogurt, but I'd eat it if it was like vanilla or blueberry or something, but there's added sugar. I would say, okay, but look at all the nutrition you're getting there with added sugar, right? Versus the same amount of sugar that might come from like licorice. So all foods fit, totally have licorice, but you're not seeing the same, that's not comparing apples to apples for the same amount of sugar, because we're looking at the higher nutrient dense food. So I guess to answer your question, number one, it can absolutely affect our health in a variety of ways. So moderation is key. And number two, prioritizing those more nutrient dense foods as much as possible is helpful.
Great. Thank you.
You're welcome. So the second one that I wanted to chat with you about is iron. So iron is interesting. We have so many women who go into pregnancy with low iron, like anemic already. And not everyone even knows when they're anemic. It often gets to the place where you're like so dragged down, and then you have blood work and you're like, oh wow, both my, hemoglobin and my stores are really, really low, and then you need a supplement to get back up there. But you may not feel awful, and you still maybe have a little bit of low iron. And so I do recommend, think about getting some blood work done. See where you're at. See if you need to boost it up. If your stores are good, but your hemoglobin's low, maybe think about adding some more high iron foods. But more than that, food combining matters more than we realize. So when you have a high calcium rich food with a high iron rich food, calcium's a bit of a bully nutrient, basically. And so it interferes with the absorption. And so we might have women thinking, okay, I know that I need to get more iron in my system and I need to get more calcium in my system. Because I really want to, these are two important nutrients for my baby. And so they're having a glass of milk with every meal thinking, oh, I'm going to have a baby with really strong bones and I'm going to leave the pregnancy with strong bones, but they're not absorbing the iron that they're taking in. And so educating around, okay, maybe you could have some iron rich meals and then some calcium rich snacks, or vice versa. But typically that's a good ratio because it's easier to put things like milk and yogurt into a snack and then something like a chicken or a beef or a salmon into a meal. And if we have someone with plant-based eating, now we've got to even go next level because there's something called non-heme iron and heme iron. And non-heme iron in plant-based foods like dried fruit and oatmeal and spinach and kale, black beans and lentils. Yes, they're sources of iron, but it's like they're stuck in there. The body doesn't absorb them very well. And so if we add a vitamin C, a source of vitamin C, when we eat these foods, it's like a key to a lock. Right? It's like the difference between when you're trying to get into your house and your key keeps sticking and you just can't get in. It's there, but you can't get in. And then you get the lock fixed, or you get a key that's cut a little better. Woo, I can get in. And it's the same thing when we add vitamin C. It's this key to get in and help us absorb the iron a little bit better. Having said that, though, the recommendations that exist around the amount of iron that we need under general circumstances during pregnancy and then postpartum, those recommendations are built on the idea of a general healthy individual. They're based on the idea of someone already having both their iron stores and their hemoglobin levels in that normal range. And so if we do have someone that is deficient, those recommendations really are out the window. We have to go higher in order to actually meet the needs to get the stores and the hemoglobin back up. And I think the other thing a lot of people don't realize is you might be prescribed something like a 300 milligram, ferrous gluconate. Well, there's only 80 milligrams of actual iron in there. And you see 80 milligrams and you say, well, I'm only supposed to have 18 pre-pregnancy and 27 to 30 during. Well, yes, but it's like you're dealing with a leaky bucket, right? You have to build yourself back up a little bit. And so understanding that numbers, the same food, the same number, it's not just this general hard and fast rule. We want to look individually at someone and say, where are you at? And we do know that low iron levels can lead to preterm labor and potentially preterm delivery, low birth weights, all these things that we know then lead to higher risk of negative outcomes. And so if we just back up the bus a little bit and say, how can we enter into pregnancy with iron levels that are where we want to see them, that can really help because it can snowball through pregnancy. As you said earlier, those babies will take as much as possible what they need to thrive, right? And leave mom. And so to an extent, you can't pull water from a stone. So we do need to at least have the amount there. We also know, though, that during pregnancy, the body is very intelligent and it will do its best to absorb more iron. It'll up its absorption level in order to try to, get what mom needs and what baby needs.
Yeah. Awesome. Yeah. And we have we put together a preparing for pregnancy guide. So it's a free download and it's got kind of our top 10 tips on kind of preparing when you're starting to think about preconception or preparing for pregnancy, some steps. And certainly one of them is exactly what you said, get your iron checked, get your thyroid checked, make sure that those things are optimized.
And another thing to think about with iron is the fact that if you're thinking about what I said with the calcium and iron, any supplement you look at pre-pregnancy has them both in there. And so if the question, to a listener's mind is, well, what happens then? You're probably guessing the right thing, you don't absorb the iron the same. You just don't. Even if it's in its highest absorbable form, calcium is there, calcium wins. So we have to look at separate iron supplements and separate iron foods. And calcium isn't the only thing that interferes. Tea is another one. So if we have someone who drinks tea with every meal, that can be a problem. Red wine interferes with iron absorption. Of course, we wouldn't necessarily be looking at that during pregnancy, but pre-pregnancy we could. So just thinking that 2-hour window, separating some of those foods and beverages that will reduce iron absorption, separating those by 2 hours really helps.
Awesome. Yeah. And that's usually what I suggest as well. So taking your iron supplement, if you are taking a supplement, taking it right before bed with a little bit of vitamin C, sometimes it can bother people's stomach a little bit. So then hopefully you're asleep if it does. And it's usually a couple hours after your last meal. So that's how I usually recommend to pregnant folks to take their iron supplement. The other thing I was going to mention is that our bodies are very good at recycling iron. So our bodies are continually breaking down our red blood cells, and then we reuse that iron to create more. We're really good at that. Our bodies are smart, but what we're not great at is absorbing the iron, just like we were talking about. So women who are menstruating monthly, and most, some people, if they have an IUD in, they're not getting their period, or if they're taking their birth control pills back to back, they're not getting their period. But once we come off of those to try to get pregnant, we're having that regular menstrual cycle. So every month we're losing blood, and our bodies aren't great at reabsorbing it. So most women who are regularly menstruating actually need to be on either a supplement or really optimizing their nutrition to make sure that they're getting that really good source of iron with the vitamin C and absorbing it really well. So I think a lot of us don't recognize that, but it's an issue. Once you hit menopause and you're not having your period anymore, then your iron stores are going to maintain. But while you're still losing that blood every month, we need to just be cautious around that. But yeah. So you kind of chatted a little bit about supplements.
Yes.
Can we use that as a segue into our next part of our conversation?
Absolutely. Yes. What would be your burning questions about prenatal?
So I guess, do you have any, so when people are starting to think about kind of preconception and planning for pregnancy, we often get asked, should I start taking a multivitamin or should I start a prenatal vitamin? Obviously we want to optimize nutrition, and that's our first step. But if that's a challenge, or, life's busy, is there like a supplement that you usually recommend, or what should people look for in a supplement?
Great question. So we definitely want to see that for at least 3 months before conception that we see a good supplement in there. And because of the fact that several pregnancies are unplanned, or, a little bit of maybe you were planning on it in a year and here it's happened. It's great. If you could become pregnant, it's good to be on a prenatal supplement. And one of the biggest reasons for that is the idea that, you can get folate from food, but it's good to have a folic acid supplement, right? Here's why. The neural tube within baby closes between day 21 and 28 of pregnancy. And we typically don't know we're pregnant unless you've gone through like IUI and IVF and you're just sitting there in your 2-week wait. You don't actually know until maybe week 5 or week 6. And by then the neural tube is either closed or it hasn't. And if we don't see a neural tube closure, we could see spina bifida, see anencephalus, there's different things that we could see, right? So no, it doesn't happen to everyone who gets pregnant and wasn't on a supplement, but it is higher risk. The other thing a lot of women don't realize is that the birth control pill actually interferes with how much folate that you absorb. Yes.
What?
So typically, I know Sarah said the same thing when we chatted in the group. She was like, hold the phone. I don't know this. I'm like, yeah. When women are on the birth control pill, we tend to see that these levels are pretty low. And so it's important to, in an ideal world, plan for a few months off the birth control pill for a variety of reasons, including this one from like a nutrition standpoint, and start in with your supplement.
Yeah. So do you have any favorite supplements? Any suggestions of what to look for? You don't have to name names.
I'm not going to do brand names. I'm very careful as a dietitian. Just very careful as a dietitian. I'm sure you're the same too. Like there's certain ones that I would say have reason to purchase them over others. But what I will say is this: you want to know how well your body is able to handle folic acid, because what you would want to do is get methylated folate. So you want to have a more absorbable like supplement in that. So this is the vitamin B9 that helps increase our absorption or that helps reduce the risk, of neural tube defects. And so what we want to make sure that we're doing is getting the best bang for your buck. And so if you're choosing a supplement and you're not going to be able to actually absorb what's in there, that's not great, right? So that's one thing to think about. And that's a genetic
will
piece.
it just say methylated?
Yeah.
On the, you just read the label.
Yeah,
look for that.
It'll say it on the list. It's not super common, but they exist. It's only if someone has the genetic predisposition though too. So some people wouldn't need that, some people would. Another thing to remember is that you're typically not going to see iron and calcium separated. And so you do want to consider taking an iron supplement later in the day. Just like you said, like I'd say the exact same thing as you. I say before bed with a little bit of like cranberry juice or orange juice, or I usually don't. Typically, under normal circumstances, I recommend whole foods over juice, but these are juices that are really rich in vitamin C, right? Or you could have it at the same time as you eat some strawberries or an orange or something like that to help with absorption. So typically separating those out can be a really good thing. One of the most important pieces, if someone's saying, well, I just take a women's one a day, like what does it matter? They sometimes have vitamin A in the form of retinol or retinol or retinoic acid. And that active form of vitamin A, if we have too much in our body, that can cause issues to a fetus. And so what we want to do instead is choose a prenatal that is has beta carotene or a few other carotenoids as used as a precursor for vitamin A. So what the body does is it takes beta carotene, converts it over to vitamin A, basically in the amount that your body needs and can use, but not an overabundance. Whereas if you take in preformed vitamin A, there is the potential of an overabundance. I don't want people worried now that if, I'm drinking milk that has been fortified with vitamin A, that's okay, because you can have the amount of milk within moderation and be fine. But if you had like a large piece of liver, or if you're taking a multivitamin that has retinol in it, or if you're using a face cream that has retinol in it that's absorbed into your skin, there is potential of you having too much of this for your unborn baby. And so that's something that you want to be aware of.
And certainly when we prescribe the oral retinoid, then we always make sure people are on a really good form of birth control as well, because that's exactly it. We don't want them. Sorry. Noelle's waving somebody away. Somebody's trying to get in on the podcast.
Sorry, my husband was going to get ice. I was like, don't do it.
So we don't want somebody taking kind of the vitamin A pills for acne when they're not on a good form of birth control and they have the potential of getting pregnant, because that can cause significant birth defects in babies. So same thing applies for all those. Now you can use a vitamin A cream when you are breastfeeding people. So that's totally fine. Breastfeeding, fine, vitamin A cream, but not when you're pregnant.
And even prenatally, like if you know for sure you're not pregnant, but once you might be pregnant, we don't want to, we don't want to risk that. So I think the only other thing I would say in terms of supplements is remembering that any single nutrient supplement may not be a single nutrient supplement. So you could be taking like a multivite, and then you have someone taking like a calcium supplement and forgetting the fact that within that calcium supplement, there's likely vitamin D, magnesium, and phosphorus. Right. And so then if you've got vitamin D in your multivite and then you're taking this calcium supplement, but you think, oh, I've heard vitamin D is really important, so I better take a vitamin D supplement. And then you take it on its own. Now you've got 3, sources of vitamin D, which is very fat soluble. And we don't want to go overboard, right? Vitamins and minerals are good for us within the limit between what is recommended and under the upper limit. And for some vitamins and minerals, it's not determined what the upper limit is. And for some of them, research is ongoing and we may see it changed over time. That happened with vitamin D. When the DRIs, which are recommendations for vitamins and minerals and carbohydrates, protein, fat, everything, when they first came out across North America, we actually had a different upper limit than what we have now for vitamin D. But being aware of what is in every single supplement that you take is very, very important, so that you are getting enough, but not going overboard.
And let's just all remember, and I think, Noelle, you would agree with me, that you can get almost everything you need from a well-balanced
Yeah.
whole foods diet.
100%.
So you
Yes.
do not need to be taking 85 supplements.
No.
One prenatal vitamin, maybe a bit of iron if your iron is low, is probably sufficient if you are optimizing your nutrition and you're able to do that. And I think, Noelle, you have a course coming out in the new year. Is that correct?
We
All
do.
around kind of like nutrition in kind of pre-planning pregnancy, early
Yeah.
stages of pregnancy, all the way to the 4th trimester.
Yes. Yes. I teach nutrition through the life cycle at our local university. And every year that I've taught it for the past 7 or 8 years, I've thought to myself, I would love to have like women heading into pregnancy learn some of these things. And so I've taken some of the like key concepts that we would say, hey, you know, as you become a dietitian, if you're counseling someone, here are some of the things to think about. And then we go deeper, right? And so I'm like, oh, why not just create a course that women who are heading into pregnancy or are currently pregnant can learn some of these things. You know, one of the things is in pregnancy, we talk about trimesters, but as you know, there's actually a first half and a second half. And the body reacts so differently to the food that you take in the first half versus the second half. And that's a cool thing to learn and understand, because the more that we understand the why, I think it helps empower us for understanding the how and moving forward with the how. And the other thing is, it's very easy before you're pregnant to think about all the ways that you want to have this wonderful, you know, nourished pregnancy. And then it hits. I know even for me as a dietitian, like at 7 weeks, I remember so vividly when I was pregnant with my twins, I had pad thai. And afterwards I was like, that pad thai was bad, or this is pregnancy nausea. And it didn't go away until they were born. I was like, oh man, like I can't stand the smell of this. And I'm a big salad eater. And the concept of spinach was like, I can't do it. So I want to give women tools to say, like, if you want the nourishment of spinach, here's why the nutrition in there matters. And here's how you can actually still get that spinach in if the concept of eating it doesn't work for you right now. Or if you're getting reflux, or if you're super constipated, or you're too exhausted to do this or that. So we've got like the challenges in there and how to overcome them. And then we're looking at the actual nutrition, you know, your carbohydrates, your proteins, your fats, your vitamins and minerals. How can we try to get that through food? So we can talk about the supplement piece, but how do we try to get that through food? We talk a little bit about food safety. We talk about when you're physically active during pregnancy, you know, how does that kind of affect how you want to think about food and hydration and that type of thing. And then we also talk a little bit about the mental health side of things, because there is a connection between nourishment and rest and physical activity and mental health. And sometimes some of those pieces, the kind of that triad of health, right, of nutrition and physical activity and rest, those go very askew during pregnancy. And so we want to really give women the tools and the systems to put in place to help with that. And then preparing for what we call 4th trimester, which is the 3 months after. So it really does look at this full kind of, you know, spectrum and create it to be one big unit.
Yeah. And that's, I mean, it sounds incredible. I'm going to take your course. But because we as physicians, right, we get a lot of training, but we don't dive deep into many topics, right? Like nutrition and exercise. And some of us, like Dr. Sarah, has taken a deep dive into kind of mindfulness, and she's doing her lactation consulting work. And, you know, I've deep dove into, you know, children's sleep. And so we don't, unless we take that opportunity to do it ourselves, we don't necessarily have the extensive knowledge that someone like yourself, who is literally trained in nutrition science,
Yes.
in how we can optimize that. That is literally what you're training in, all you do all day, every day. Unless we access people like you and have the ability to take these types of courses, like you just can't get at that information in a kind of well-packaged, reliable way. So I think it's fabulous that you guys are putting this on, because we have so many questions from, you know, newly pregnant or trying to get pregnant, like, what should I be doing? What should I be eating? And we give the best advice we can, but certainly we do not have that background to really be kind of diving deep in. So I think it's fabulous. And the whole preparing for postpartum piece is like, we actually did a podcast with Kristen Yarker, who's one of our local dietitians.
Amazing. Yeah.
And she did a great job. And then we did another podcast on preventing postpartum depression. So nests, and the first letter is N for nutrition. Right. And so obviously it was a psychiatrist and myself. Neither of us are dietitians. So we gave some general advice, but this course would be incredible because it actually probably breaks it down step by step, makes it manageable, makes it easy to do that. So I'm super excited for it. And I'm
Everyone
so happy that
focuses
you're doing it.
on the baby, right? Everything is focused on the baby. Is the baby healthy? Is the baby thriving? Is the baby okay? And I'm really passionate about mom. Like, don't get me wrong. I want your baby to be really healthy, but I also want to know that you're going to come out of pregnancy healthy, because we know that it's like the oxygen mask, right? On an airplane. Like, there's a reason why the adult puts the oxygen mask on first. And I want to educate and empower moms how it's not selfish to prioritize some of the care that you need. It actually is a direct way that you are caring for your baby. Right. And
you are making your baby's food. You are literally
yes.
in your body.
Yes.
For most people, some people choose to use formula. Totally fine. Whatever works for your family. But if you're breastfeeding, you are literally making the food in your body from what you put in. And so it's that nutrition piece is so important for so many pieces. But that is that's a whole other world.
It's like 5 podcasts in here.
So many. So I think that I'm really excited for this course. So we will definitely let people know when it is coming out so that they can get in on that. But you've got a website and you've got kind of some free downloads, some free tip sheets that people can start off. Can you tell us a little bit about that?
Absolutely. So we have 2 free downloads. One of them is to help manage nausea during pregnancy. And so you can grab that through the link of the profile of in Instagram, we're nourished.beginnings.pregnancy. And then we also have one that outlines now all nutrition matters, obviously, but these top 8 nutrients that we would look at, a few of which we talked about today. We didn't even get to like choline and biotin and there's other nutrients too. So the top 8 things that you'd want to think about, are you preparing your body really well for pregnancy and then during pregnancy? So that's a free download. And then we also have a couple of meal plans that we've put together. Actually, we call them meal and recipe guides, because really, I am not for saying like, you need to have this on Monday and this on Tuesday. It's more like, here's some ideas that are packed with the nutrients your body would thrive best on while you're pregnant. Or while you're breastfeeding. And so there's one that's for during pregnancy and one that's during breastfeeding. And we've made them very economical. They are not free, but they're only $7. So, and it gives you like 50 or 60 recipes in each one to be able to go ahead and feel like you're equipped. And I know we're really focusing on pre-pregnancy here, but I can't say this enough, how important it is to be ready to ask for help. At any point in time, pre-pregnancy, during pregnancy, or after, you are not weak when you ask for help. If you find a recipe you really like and someone's saying, how can I help you? Instead of like, come hold the baby, make me this lasagna, please, right? Don't be afraid to ask for that help. If you're going through a struggle of infertility, sometimes it's hard to cope with just everyday tasks, and someone wants to, be a good friend. Can you make this for me, please? Because it would be great to have my family fed. So those are some resources that we already have available. And then, yes, very early 2021, we have our full course coming out. We also do one-on-one counseling as well. My business partner and I are both, Angela, we're both licensed in Ontario. And then as of next week, I'll be licensed in BC, actually, to do one-on-one counseling. So that's another option as well.
Awesome. And your website is nourishedbeginnings.ca, correct?
Correct. Yeah.
Awesome. So, and we'll put the links to Instagram and the Nourished Beginnings .ca website on the show notes for this. So you can check that out. And then we'll put we'll figure out how to make it easy to access the free downloads and stuff for you guys. But yeah, this is great. Thank you so much, Noelle. This is lovely. And we will do another podcast on how to manage kind of some of those symptoms of first trimester. So that'll be our next adventure together.
Sounds great. Thank you.
Cool. Great. Have a great day.
You as well. Bye-bye.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.